Hi guys, once again Ijaz Hidayat is with you with new talk and with new discussion. Today we're going to talk about the Del-Nido Cardioplegia. Last time we discussed about the custodial HTK, but today we're going to talk about the usages of Del-Nido Cardioplegia. Del-Nido Cardioplegia is anaerobic glycolysis, and its production of ATP has been shown to be inhibited by excess of hydrogen ion. The Del-Nido Cardioplegia is a mix incorporates sodium bicarbonate as a buffering solution to sequing the excess hydrogen ion to assist to maintaining the intracellular pH. Del-Nido Cardioplegia is a intracellular type and even the extracellular type, which provide a long-term myocardial preservation during the arrest of the heart. Custodial and even the Del-Nido both are intracellular and even the extracellular, and both provide a long-term myocardial protection during the cardiac surgery, and even the both have like a custodial and even the Del-Nido both have a different cardiac arrest mechanism. Like a Del-Nido causes a depolarization arrest, but the custodial HTK is providing hypopolarization arrest. So we're going to talk about the component, the content which is going to be used in Del-Nido Cardioplegia. So Del-Nido Cardioplegia is mixed in a solution called plasma light, and in a plasma light we added mannitol 20%, like 2.6 gram or 3.2 gram of the mannitol. Then we use the magnesium sulfate 50%, almost like 2 gram, sodium bicarbonate 8.4%, 13 milli equivalent, and potassium chloride around 26 milli equivalent. And of course in the Del-Nido also there is a lidocaine 2%, and this is 130 milligram of the lidocaines. So the mannitol is almost like 16.3 mils, magnesium sulfate 4 mils, sodium bicarbonate 13 mils, potassium chloride 13 mils. The one we have in 2 milligram per mils, so 13 mils. So then if you have the 1 milligram per mils, then you have the 26. And then we have lidocaines with 130 milligrams, almost 6.5 ml. So the total component of in the plasma light is the solution will be 1052.8 ml. So this is the cardioplegia solutions. So the usages of the cardioplegia solution, of course, we are maintaining the temperature of the cardioplegia is 4 degrees Celsius. The dose was calculated if you're using adult or a pediatric, we're using 20 ml per kilograms. So will not exceed more than 1 liter actually. So if you have small patients like 20 kilograms of course to 22 mean almost like 400 ml of the cardioplegia. So but if you have the big patients like 70 kg or 50 kg or 80 kg, so the maximum dose, the first dose we are giving like 1 liters. So actually in the Del-Nido Cardioplegia, if you're going to talk about the routine cardioplegia, blood cardioplegia, and Del-Nido Cardioplegia, in a blood cardioplegia we give the concentration is the ratio is like 1 with the ratio 4. So mean we are using 1 part of the crystalline and 4 part of the blood. But in the Del-Nido we are using 4 part of the crystalline cardioplegia solution and 1 part of the blood patient's blood. So in a simple words, we are using 20% of the patient's own blood, which is going to mix with the 80% of the crystalline cardioplegia, Del-Nido Cardioplegia. So it's mean like in a normal blood cardioplegia, we are taking 4 part of the oxygenated blood and mixing the 1 part of the crystallite, but here now we are taking 4 part of the crystallite and 1 part of the blood cardioplegia. So it means in a liter. So in a liter you will find 800 ml of the crystallite, Del-Nido, and 200 ml of the patient's blood. So it's going to mix it and we deliver to the antigrade or whether retrogrades. So the first dose will be 20 ml per kilogram, and after giving the first dose of the Del-Nido Cardioplegia, the arrest time of the heart muscles is like at 90 minutes. So your heart will stand still for 90 minutes. If the time reached to the 90 minutes, just inform to the surgeon. If the still surgeon need to do work on heart like at 10 or 20 minutes, you can continue with the same. But if surgeon need a more time, more than 2 hours, then of course you have to repeat the dose of the cardioplegia, Del-Nido Cardioplegia, and the Del-Nido Cardioplegia, the second dose will be like a 10 ml per kilograms. So now the 50% of the dose of the cardioplegia, so which will give you more time. So once you reach to around a 90 minutes, just inform to the surgeon that when the cardioplegia time is 90 minutes. If he need to work more than 2 hours, then he will going to repeat the cardioplegia dose. So now will come up how to set up the circuit of the Del-Nido Cardioplegia. So guys, I will try to show you through the pump then what is the difference between the routine cardioplegia, blood cardioplegia, and Del-Nido Cardioplegia. It's circuit. So we'll come up with a circuit now. So guys, in the Del-Nido Cardioplegia, see, if you see now, can you show here? See, this is your routine blood cardioplegia circuit that we see we are getting the blood from oxygenator into the main pump. This is dual pump actually. So this is the master and this is the slave. So this is the routine actually I'm showing. That we are getting blood from the oxygenator and from the crystallite, and we are going to mix it here, and we are returning back into the cardioplegia. But for the Del-Nido, we have to do the opposite. So this is your main pump. So now it will be reverse. So the crystallite part will come here and the blood will going to there. So now we're switching off. So now the crystallite will become the main pump, and the 1/4 tube which is coming from the oxygenator, it will going to be switched to as a slave. So once you are going to start this plegia pump, so your crystallite, the Del-Nido plegia, will be the main. So 1 with the ratio 4. So mean we are taking 4 part of the crystallite and 1 part of the blood. But in a blood cardioplegia, we are taking 4 part of the blood cardioplegia and 1 part of the crystallite. But if you're using the Del-Nido, so you have to change the tubings circuit. So your main pump of the cardioplegia will be with the crystallite, so with a small tube like a 1/8 tube, and your slave pump, which will before with the crystallite, it will going to be switched to with the 1/4 tube as the blood cardioplegia. So it's mean that in Del-Nido we are taking 4 parts of the crystallite and 1 part of the blood cardioplegia. Hope it is clear. Have a nice and good day. Take care. Bye bye.